So when you have a patient with peripheral neuropathy, there are a number of treatment options to deal with that. The main treatment option is medication, which I've dealt with in another video. There are also advanced pain management procedures, but there's a treatment which is called radiofrequency treatment. Now, when you're faced with a patient with peripheral neuropathy who's not responding to medication, for example, or they're getting a lot of excessive adverse effects with medication and so they can no longer take them, this is what we would refer to as a minimally invasive pain management procedure which we use in order to improve the situation. Now, the majority of patients who have peripheral neuropathy, the pain that they experience will be in their feet, in their foot and ankle, usually on both sides. Now, there are nerves that come out from the lower part of the back, usually the L5 and the S1 nerve roots. These are the big nerves which come out right at the bottom of the back and essentially travel down and ultimately will supply nerve supply to the feet. One treatment option that we have that can be very successful is to bring the patient into hospital as a day case. We would put them under an X-ray, a little bit of very light sedation so they feel nice and relaxed, and then we put a tiny little probe down to the nerve root. So in this procedure, the two main targets that we're looking for are right at the bottom of the spine here. We're looking at the L5. There's a nerve root which comes out at this level, the L5 level, and there's one below it which comes out of the sacrum, which is what we call the S1 level. Now, these are the two nerve roots which essentially supply most of the nerve supply to the feet and ankle. When patients have peripheral neuropathy, we will put a tiny probe, it's known as a radiofrequency probe, that is put down to the L5 nerve root and to the S1 nerve root. Those electrodes are then connected to a radiofrequency machine. We put a small electrical current through to test the nerve to make sure that we're in the right place. And the patient will essentially experience a dull pulsing sensation. And then we just very, very carefully move the probes until we get exactly the area of coverage where the patient's experiencing the worst of their pain. Now, once we've achieved that using as small a current as possible, we would then put cycles of an electrical current through the electrodes into the nerve roots in order to try and reset the nerves and make them function properly. So, as I said, this treatment is called pulsed radiofrequency, in this case pulsed radiofrequency to the lower lumbar nerve roots. The actual treatment itself usually lasts for between 2 to 3 minutes. It can be done for longer. The most important thing is that this treatment is non-destructive. So we're not damaging the nerves, we're not cutting the nerves, we're not irritating them in any way. We're actually using a type of electrical treatment called radiofrequency to try and reset the nerves and make them work properly and make them work in a normal functioning pattern. In terms of risks and benefits, the benefits of the procedure are pain relief. It will take approximately 10 to 14 days to work, sometimes less, sometimes more. In terms of risks, these are failure, local bleeding, bruising, infection, discomfort. You may get some numbness, weakness, pins and needles afterwards for a few hours, and about 1 in 2,000 people may experience a headache after the procedure. In terms of the overall success rate, we're usually looking at approximately 65% chance of success of reducing the pain by a minimum of 40% for at least 6 to 9 months. The procedures, if they're effective, can be repeated, and often we will have patients who will have the procedure done approximately once or twice a year. That will keep their symptoms under good control. And once we have those symptoms under control, the great thing is that if they are on any other medication, it may be possible to cut down on that medication, which may be giving them side effects, and they can get on with things much more easily.